Welcome to yet another episode of Meet the Masters. There's a famous saying, to keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. Today, we have with us a very eminent and distinguished personality, Mr. Taher Shams, Managing Director, Sulekha Group of Hospitals. Welcome to Meet the Masters.
Thank you for having me.
As you know, sir, Sulekha Group of Hospitals started way back in 1964 with its founder director, Dr. Sulekha Daud, with a vision to provide affordable medical facilities to the common public. So now it has grown like anything. There is a great success story. So now Sulekha Group of Hospitals is having around 2 multidisciplinary hospitals in Dubai and Sharjah, then 3 UAE medical centers, 1 diagnostic center, and 3 pharmacies. Can you explain about this journey, this great journey?
Well, this journey started way back in 1962 when she thought of going out of India and doing something of her own. So she flew to Kuwait, and from Kuwait she was deputed as a lady doctor in UAE. So she landed here in 1964. So yes, that's the year you can say that Sulekha Healthcare Group started shaping up. She worked for the Kuwait hospital in Dubai. Then she was shifted to Sharjah and thought of starting her own medical center. First came into existence is the medical center, and then thought of starting hospital in 1992. So actual journey of Sulekha Hospitals started from the year 1992. If you see how we progressed, we started as a primary care clinic, and then got into secondary care and then tertiary care. So it all happened over a period of time and not in one go. So we always believed in Sulekha Healthcare Group, and that's her belief also, that let's grow organically. What you do today, what you get, put it back in the hospital, and then introduce new departments rather than like coming up. So how it all happened, that we understood what is the requirement of the market and what the general population in UAE needs. So we started with basic maternity, then we climbed into internal medicine and orthopedics and cardiology, then angios and so on. So this is the journey from primary care to a tertiary care. And first was the Sulekha Hospital Sharjah. If you see our buildings, they're into bits and pieces first. So first 15 years, we kept on expanding one building after the other. Now the building where we are sitting right now, it's like a purpose-built facility, which is ground plus 12, which has any and every department you can think of. So here we are in the latest facility of Sulekha Healthcare Group. We are also coming up with expansion in Dubai. And as you mentioned, other medical centers and pharmacies are also there in the group.
You are with Sulekha Group of Hospitals since 1995. So how was this journey for you?
Well, it was a wonderful journey. A lot is learned during this time and implemented. Got full freedom from the founders to do whatever we believe we want to do and is good for the organization. So the best part was that we were given with a free hand, that with a full confidence actually, that do what you believe is right. And that was something which I always cherished and appreciated, and made sure that we felt like a lot of responsibility when we are given with that kind of freedom. Like there's always a chance of misutilizing those freedoms and doing things in a cowboy way. So we didn't do that as a team, and we took a lot of calculated risks that freedom gave us.
What makes Sulekha Hospital different from other healthcare providers in UAE?
I think first and foremost is affordability, which definitely stands out. The other thing which I can mention is patient experience. When I'm talking of patient experience, that means providing everything under one roof, rather than sending patient to one center for this test, to another for that test, and so on. So uh, that convenience also we are providing. So by saying that, we are introducing more and more outpatient departments in our hospital. We are also standing out, or we are the first ones to have our specialists the whole night, actually. And we are also one of the first ones recently, we have started to have full hospital functional on Fridays. The reason to do that is a simple thing. When people can go to malls on Fridays and malls can be full, why not hospitals? Hospitals from this angle, that you are off, children's are off, everybody in the family has a holiday on that day. So that is the best day you can take care of your family. Uh, a small example, if somebody is not well on a holiday or on a Friday, the full family doesn't go out and probably take care of that person. But they don't find healthcare facilities open on Fridays. So that was the need of the hour. And currently, I feel that our being open on Fridays, are being open on at nights, the whole night, that makes us stand out. And I think others will follow and should follow, because we all are into services, and we should be there when we are needed.
No, it's 24 hours.
That's almost 24 hours, you can say, yeah. Because that was not the norm to have specialists at night, like from 11 p.m.
it's
to
not
7
possible.
a.m. Doctors used to be only on call, like on the need basis. But
Yeah,
then
they are also human beings. So
yeah, you don't know when the emergencies are going to arise. So we have to be there when patient needs us. Not that, like, when patient is there, then we'll call doctor and then they'll come. So a lot of time is lost. And here we are dealing with lives. So we have to be ready for the patient and wait that when they'll come, we'll treat them. So it's like
suppose
saving lives.
if a specialist is not there, what step you will take normally? If it's night?
First and foremost is patient has to go to ER, and that's where they're taken care of first. So, and then specialists are called. But now, specialists are on board. So immediate treatment can be given. Now, if you, just for example, like if somebody is coming with a heart attack, and if I have to call a specialist, and specialist is somewhere in Dubai in some mall, for example, and that time is lost. Who's at loss? Patient. So that should not happen, and there has to be a doctor 24/7 taking care of that, so that we take immediate actions and patient can be treated. So this is what I was talking
At
about,
least the
patient
first,
experience.
first aid we can give.
Exactly, immediately. So we are actually known for our doctors being available anytime and every time, for our ERs. So that's why our ER is very strong in Sharjah and in Dubai. Just because of that reputation, that go to Zulekha and you'll find somebody to take care of you.
Our audience would like to know the challenges that's being faced by the healthcare industry currently.
That's a very good question. I think there are plenty of challenges a healthcare or a hospital goes through. And first and foremost is the manpower, like where to get the right manpower for your hospital or a medical center or for any other healthcare facilities. Number two, I'll say like technologies, because they're ever changing in healthcare, and they're so capital intensive. We have to always be on our toes in terms of bringing those technologies to masses and continuously upgrade your equipment and so on. A small room, you can have 5 million, 10 million or 15 million dirhams worth of equipment installed, and you feel that so what? But hospital providers know exactly what has gone in. So when you have all these challenges, yes, you have to follow a lot of deliberations in what to buy now and what to do next. So it's the challenge is like to prioritize. You have so many things to do. We have to set our priorities. Okay, in this month what you're going to do, or in this quarter what you're going to do. So that's always a talk within the management team, within all the HODs of all the departments, because they have a continuous requirement every now and then. So a lot of support services are also needed to run a healthcare facility. When you see this facility, there's a lot happening in the background. There is a whole building management system which is running around. There are a lot of people sitting in the basement and making sure that each and every area is functioning the way it is supposed to function. Also, when we are talking about challenges, yes, we are always required to be on our toes in a good way, that regulatory wise that we are compliant in each and every areas, be it Department of Health or Ministry of Health. We have to always make sure that we are complying in terms of policies and procedures, and every now and then there are improvements in those policies and procedures, and we have to make sure that we stand by those policies, we complement, and we go hand in hand with the government departments. Another perspective is the insurance side of it. Now you're seeing that governments are going out and making insurances mandatory. So that will bring in a lot of challenges to, not to us, but to the industry as a whole, because first timers are going to come into market who will experience insurance first. And of course, we have to make sure that do they require those services or they don't, or they're just coming to try it. So it's a challenge for healthcare industry and for insurance, healthcare insurance industry, to make sure that we do things right.
Recently, we heard that Sulega Group of Hospitals has launched another hospital called Alexis Multi-Speciality Hospital in Nagpur. How has the operations been there, and what are the specialties that's beneficial for the common public you can offer?
When we thought of building a hospital in Nagpur, namely Alexis, we did conduct a study that what the market has and requires in terms of healthcare. And the study came up that there is a huge gap in terms of healthcare, what is required and what is there. Oncology services, neurosciences, cardiac sciences, dialysis, transplants, and so on. So we are actually venturing into all these areas. And when we did this as a study, there was no good facility within the radius of 300 kilometers of Nagpur. So when you think of such a requirement, you want to do everything possible under one roof what you can. So yes, it took us 5 years to build this facility. It has, a lot has gone into this facility in terms of infrastructures and so on. We have followed American guidelines to build this hospital in Nagpur, which is considered as a Bible of healthcare in terms of planning and building. We've also gone for green, e-green systems within the facility in terms of lighting or solar system or recycling of water and so on. So nothing of substandard we have done. Actually, everything is at par with the international standard, what is required. And of course, the areas which I have mentioned are going to complement with the facility itself. The standalone oncology center providing cancer care to patients is a big thing, because there is no radiation therapy available in that region, in that area. So we are coming up with Varian Liniac system for the radiation therapy. This is going to help this particular department in a big way. When we're talking of dialysis, then again, with a proper RO system, with the international standard, the dialysis facility is available. We'll be introducing transplant, kidney transplant and liver transplant later on, once we are fully ready for that. But cardiology-wise, we are fully ready, fully functional. So anything which we think lacks or requires a lot of improvement in that region. Probably it is provided today, but not at the level what it should be. Because still what's happening in Nagpur, that major population flies out of Nagpur, goes out of Nagpur, travels out of Nagpur. Either they go to Hyderabad, Chennai or Mumbai. So the idea is to provide all those things in Nagpur. That's the best part, is that they are able to live with their relatives in the same city. They are looked after in a good way, and they get locally everything what they're going for outside.
Is there a particular area of focus for Sulekha group of hospitals, particularly in Dubai and Sharjah?
Yeah, areas of focus, yes, currently even the governments are also talking about medical tourism. So we are also focusing big time on that, and getting all sort of support possible from Dubai government, Sharjah government, from Dubai health authorities and Ministry of Health to promote UAE as a healthcare destination and offer anything and everything possible in the healthcare, and bring in best of the technologies to our hospitals, and project them out either to the Western countries or to African countries or within the Middle East. So no doubt I have full faith and confidence in the healthcare system of United Arab Emirates, because we know that we all are doing right. Now we are asked to follow certain standards. There are global standards. We have Joint Commission International standards for our facilities. We have certification from American Pathology. So they are these standards when you talk of quality. When we project our facilities out to the outside world, we are at a level playing field. So that's the area of focus, to make awareness within the region and outside the region that what UAE is all about, what UAE can offer in terms of healthcare and the technologies available. It's all cutting edge. I think you don't find such technologies changed so fast, even in the West. We all are doing it here. I mean, I'm talking on behalf of healthcare industry. I think not us, but everybody is committed to this.
Have you got any current plans to introduce some latest technology or equipments in a cost-effective manner?
Yes, we always come up with some or the other initiatives in terms of providing it a very cost-effective way, because this is the standing instruction from Dr. Zulekha that do not increase prices, because we are here for the larger population and we want to remain so. So time to time we come up, even we provide some of the services free, as we have CSR campaigns going on. So we provide free mammograms, free checkups, free a lot of freebies. So that's the free part we are talking about. But when you're talking about cost effectiveness, yes, currently we are running this, that LASIK, whoever wants to do, will be doing it at a very, very cost price, actually, I should say. So such initiatives do give us a big boost in terms of awareness within the community, and in return we get a lot of appreciation from the community that they need this, they need it at their price, and they're getting it. So that is very much heartening for us, and this is something we call it as like giving back to community.
Recently, Sulekha Hospital has launched a smartphone application in JITEX. So it's your motto to move along with the technology advancements. How do you feel it's going to be beneficial for the patients?
Well, as you know that now everyone is roaming around with smartphones and so on. So what a wonderful way to get in touch with the people who wants you wants you when they want you. So yes, we came up with this app, and it's not that this app is just the promotion of our facilities, but it's very interactive. When I want to know my lab reports, for example, that will be available to me on my smartphone. If I need my medical reports, my diagnostic reports,
Appointment with the doctor.
appointment with the doctors, yes, very much. So these all interactive ways we have opened up through smart apps, and we are constantly understanding the needs and requirements, taking feedbacks even through smart apps, and asking our audiences, our patients, that what more you need. And based on those feedbacks, we are incorporating those systems and services. And also, we have also provided it to our management team as a wonderful tool to gather data, real-time data, in terms of feedbacks from patients, in terms of what is required to outside population, and how to reach out to all of them instantly. I think these smart apps have really given us a wonderful opportunity at a very cost-effective manner to connect in a good way, connect with the intentions of what they want, and give them exactly at the end of the day.
Recently, Sulaga Group of Hospitals won CSR awards by Dubai Chamber. What are the major CSR activities undertaken by Sulaga Hospitals?
As we speak, in fact, we are also nominated for CSR label for this year as well. And yes, in terms of reaching out to communities and doing CSR, we have several initiatives running. Pink It Now, Watch Your Back, and so on. So what we do is we go out and reach out to masses, and as you mentioned that we came to one of your companies as well for awareness campaigns. So like this, we go to universities, colleges, schools, and so on, and give them talks in terms of prevention, that
Awareness campaigns.
and also offer preventive checks. Now, a lot of mammograms, like almost 3,000 mammograms this year, breast check for breast cancer, we have offered free this year. We have also offered many other packages free for the masses. So the idea is to reach out, to tell people that what is good and what is not good for you, and let them decide. So we start this from schools itself, because that's where you can tell them what is required, what is not required in terms of diet, for example, or taking care of brushing practices and so on. Small things, but that adds a lot in the long term. A lot of our doctors do go out to labor camps, and they don't only give talks, but practically teach them hand wash techniques, for example, that how just a small hand wash can save you from diseases. So like this, many initiatives over a period of time, internally, externally, that's the result of CSR. I think they have recognized us and our efforts in the community, and they've been noticing that what the group is doing all around, and I believe we are thankful to them, of course, for recognizing it.
So another award called Patient Satisfaction Award by Medigo. How do you comment on that one?
As I said, we are the group, we want to focus on patients and patient experience, providing them what is needed at that point in time. That's the satisfaction award. I mean, we're talking about, and they have recognized, they've done this study outside and their own digital way, whereby they found that patient experience within the facility is very good, less waiting time, patients seen by appointments. Yes, there are always, like in healthcare facilities, there is a lot of waiting time that we have been constantly working on. And when anybody who's not well don't want to wait for a minute, but then there are people who are waiting ahead of us, so that's always a challenge. And I believe this is not only limited to our facility, this is a general notion of healthcare industry that, oh, if I go to a doctor, I'm required to wait for 30 minutes or 35 minutes or so on. But yes, we've studied that and bringing it down, making sure that patients turn up on time, keeping them informed beforehand, sending them SMSs, sending them messages, look, your appointment is on such a... So the onus is also on the patients also to turn up on time so that others don't suffer, because otherwise it becomes a chain effect. So we've done a lot of communication with our patients that, look, your appointment is tomorrow, your appointment is after 1 hour, 30 minutes. So like that, when you communicate with them, the pressure is there on them as well, and also on our doctors to see that patient when he or she is supposed to be seen. Reduction in that, and also good experience within the facility, less touch points, more clinical touch points in terms of when I need something. So all in all, that study showed to them that yes, we are at par with their experience, what they are looking for. And I believe this is in recognition to that.
Any impending expansion plans for Sulaga Group?
As we discussed that we've just opened our Alexis Hospital in Nagpur. Also, last month we have opened a complete new wing, renovated wing in Sharjah, which is going to be, which is actually 32 bedded. And also we are doubling the capacity of our hospital in Dubai, that's in Al Nahda. So that's going to be almost one full building, what is there currently. So adjacent to that, we are building another building with 3 basements and 4 floors. That will have state-of-the-art oncology center and many other OPDs and IPs and NICUs and ICUs and so on. So there is a major expansion happening in Dubai. And constantly we are studying the requirements of the market, what to introduce, which department to introduce and so on. In our existing facilities also, what we are doing is we are creating center of excellences, be it is bariatric or LASIK or cardiac and so on. So as we have climbed into tertiary care, we are further drilling down that what is required more in those departments in terms of manpower, in terms of equipment and so on. So that's a continuous process and it will keep on happening for the group.
So any message to our viewers?
Hi, this is Taher Shams, Managing Director, Zuleika Healthcare Group. I wish everyone at Medibiz TV and their viewers a very happy New Year.
Before winding up this show, I would like to remind one thing. Happiness is always a reflection of your health. So be healthy. And life is only once. If you do it right, just once is enough. Thank you, sir. Thank you for being a part of this show. Thank you so much.